Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. Good morning, Go Country listeners. We hope you've been tuning to our show every Sunday to listen to our Beauty Blueprint show. I'm your host, Dr. Joshua Jacobson, your beauty architect, and I'm here with my co-host, Ashley. Ashley, take it away.
Good morning, everyone. This is Ashley, Dr. Jacobson's care coordinator. We have such a great show planned for you today. Today, we're talking about plastic surgery addictions. Dr. Jacobson, we are really going to get into some specifics today, aren't we?
Let's do that.
Before we get started, tell me, what has been the best part of your week so far?
Well, the best part was, it was my birthday. So we celebrated a lot. Celebrated for a few days.
Happy birthday, Dr. Jacobson.
Thank you.
What did you do for it?
So we went out a few times. One time with friends, one time with family, and one time with some farther friends.
Great. I still owe you a birthday lunch I promised you.
Oh, that's true.
Maybe
right.
after this. After this. Okay.
How about you? What was the best part of your week?
I think it's right now. It's today. It's doing this show with you.
Oh, really?
This is always so exciting. I love doing this. This is definitely the best part of my week.
Oh, thank God.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
All right, so let's go into it. So Ashley, on today's show, we want to talk about addiction to plastic surgery. So we want to talk about everything that basically is the negative connotation of plastic surgery, the negative perception, because people think, well, if I get one plastic surgery, I'm just going to get addicted to it as if it's heroin. No, it's not. And we're going to get to it.
I got it. I understand. So, Dr. Jacobson, I was thinking about our past patients and our consultations, and I was thinking about the Chippendales dancer that got on Zoom with us, and we thought, wow, what is he going to want? And he wanted his belly button redone because he didn't like the way it was winking, and he wanted his smile wider. And this brings me to my question for you. What signs or behaviors would lead you to suspect that someone might be addicted to plastic surgery?
Well, that's one of those. So here's the thing. With plastic surgery, it's trying to, part of plastic surgery is to undo the things that happen with aging, with time, with gravity. So there are some things that are legitimate. For example, if, let's say, you get pregnant and your skin stretches and you want to get that skin off, that's fine. But then there are these things where you are trying to look a certain way and you think, well, you're a clay and I can just mold that clay in a certain way. You can look like a certain celebrity or someone on TV. And that's when you have unrealistic expectations and you're kind of addicted to plastic surgery. Especially if you've had a lot of plastic surgery in the past and you're kind of liking that whole process, then that's when I suspect you're addicted to plastic surgery.
There was one time that I woke up from anesthesia. This was not from a plastic surgery. And I woke up and there had been nothing positive done with my body. I go, what a waste. What a waste of going under when I didn't even wake up with I didn't wake up with a new boob job. I didn't wake up with a no nose. It was like a stupid, simple procedure. But I was so disappointed. I woke up and I didn't wake up a brand new person or with a new pair of implants. It was so disappointing. Yeah. How funny is that though, right?
I hope you're not addicted to plastic surgery.
Do you think I am?
I don't think so. Do you think?
No, I don't think I'm. I don't think I'm addicted. I love seeing the positive results from it. And I think that, there are many tweaks. Being that I'm 38 now, I'm close to 40, that I have to keep up appearances, and it's tough. The gym only does so much. So I'm partially addicted to the fact that I know I can always take care of myself, and that it's a great way of doing it. But no, I wouldn't say that I'm addicted to plastic surgery per se.
Addiction can be in any field, in any way. You can be addicted to working out, you can be addicted to food, to shopping, to drugs. Same thing with plastic surgery. You can be addicted to that because it's something that you can go and request, kind of like shopping, you can shop for it. But not that many people get addicted to it, obviously, because there's pain involved, there's a lot of procedure. But there are people that do get addicted, especially if they have the money. So that's something that we always have to be careful. You and I are always screening through patients to make sure that we're not falling in that trap.
Right. I see, I have a personal friend who's on her third nose job, and she now wants to go get the tip refined. And I'm like, okay, enough is enough. They start nitpicking. They stand in the mirror and nitpick. Who notices that the tip of their nose that much? It's very, that to me is addiction. Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
One of the things you asked me yesterday was, are there procedures that people end up being more addicted to them than not? And the first thing that came to my mind was rhinoplasty. It's one of those things that you see a lot of people get it multiple times. And I've asked people who've had it multiple times. I've had consultations that come in, they say, I had it twice and I'm still a little happy with this and that. And I tell them, well, it's very unpredictable, the result that you can get. Let me ask you a question. If you were born with this nose right now, would you do surgery on it? And they think about it and they're like, well, I don't think so. I'm like, okay, so then not, because it could go either way. You've had it twice and you know that it can go either way.
Right.
So while we're on that topic, rhinoplasty has some legitimate indications. For example, if you have deviated septum, or if you have a really large hump, or it's very projected, or your tip is very wide. So there are some things that you can actually improve and are reasonable. But then there are things that people just get so nitpicky, and they bring some celebrity and they say, I want to look like this nose. And you also got to know, when you do too many surgeries on your nose, then it just loses structure, and then you end up with Michael Jackson nose, which is the most famous nose. And that's the example I bring to patients when they want all these multiple surgeries. I tell them, don't end up like Michael Jackson.
Right. And I see that, because my nostrils are uneven, and that's the biggest complaint of my nose. So I want a rhinoplasty just for the fact that my nostrils are uneven, and the driving one's higher than the other. I have to tilt my head in every picture just to make sure so no one notices, because it's very self-evident when I'm straight forward. It drives me nuts.
Yeah, but you see, you're not addicted to plastic surgery because you see you haven't done anything for it, and it's not like you're rushing to do it, or you're pushing to do it, or you're sitting every day crying.
Right. Well, if I had some time off, maybe then I would do it.
Well, for now, we're so busy with this radio show and the patients that we don't have time for that.
Someday.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040. And leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
So is there any factors that you believe contribute to a patient's desires to have repetitive surgeries?
Yeah, so as I mentioned, time and aging doesn't stop. So there are some legitimate changes that happen in people's bodies, and some people just want to undo those changes that happen with time, with gravity, with childbirth. So for example, if someone has had multiple children and then they want to get rid of that extra skin or fat, or if, let's say, someone just has this genetic tendency to store fat in certain areas, like their chin, their or their neck or say their arms. And we do surgeries for those. Obviously, yes, that might be 2 liposuctions. It's a repeated surgery, but it's kind of legitimate. But if they come in and they're like, well, no, I don't like this little thing here, this little thing there, then that's kind of like it's a red flag for repeated surgery.
Got it. Thank you for explaining that. Are there any, have you ever had to refuse a surgery due to concerns about a patient being addicted?
So yes, there are different reasons why I would refuse surgery to patients. Number one is if I've seen them do a lot of surgery on that part of the body and they're still not happy, and I think their concern is out of proportion to what that we're seeing. That's one of those. Number two, if I see they have a lot of personal and family issues and it seems like that's kind of getting intertwined with their whole body image, and then I know, well, no matter what I do, how good I make them look, that's not going to make them feel better about themselves because they have other problems with their life, with their partner, with their family. So that's another one. Another case where I refuse surgery is if I think that person is having unrealistic expectations. They might say, well, I want my buttock to look so big that becomes, that I have a hard time sitting in the airplane. And that's very unrealistic and that's unhealthy. So I refuse to do surgeries like that.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800. We once refused a patient that came in for a BBL, and she had no body fat, first of all, to put into her butt. And so her spouse was trying to make her gain weight just for us to take it out to put it. And it was unrealistic expectations. And I don't think that no matter what type of BBL we would have given her, she would have been happy. Because number one, she wasn't even doing it for herself. She was doing it for him. He came in here, wouldn't let her talk, told the doctor exactly how he wanted her butt to look. She just sat there so nicely and smiled, such a sweetie. And the surgery was for him. And it's like, when do you say, no, I'm not gonna operate on you? And that was the first time while working for you in your practice that you actually turned someone away.
Yeah, and also because it would be unrealistic to be able to get enough fat to give the results that they wanted on top of everything else that you talked about.
Yeah. How often do you feel that we see patients that come in for revisions or additional surgeries after already having multiple procedures?
So luckily, I haven't had a lot of these kinds of patients, but I have had cases where they had surgery elsewhere, be it overseas or be it at other plastic or at cosmetic surgeons. A lot of times, not even plastic surgeons, and they really had really bad results. And they come in, they want us to fix them, and I see the legitimacy in that. Sometimes I can help them make them better, which we've done several times. Sometimes it's impossible because it's sort of like a canvas. If you already have a painting on it and you want to redo it, you have to erase it, and you can't really do a good job when you're doing a second time because there's still residuals from the first time. But if there's a blank canvas, you can do all kinds of things.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. I was in shock. So we just had a patient come in, and her last tummy tuck scar literally almost looked like an S or like an infinity sign. And she came in and she wanted a whole new revision of her incision, a whole new tummy tuck and all that. And we actually lost this patient as a client because she got home and realized, I'm still not going to get the results that I want. And we have people come in all the time that, and it's scary how many belly buttons are botched, how many not C-section scars, but C-section scars, but people are left on the table being stitched up by a nurse that their incisions look terrible.
Yeah, and sometimes we can help them. So if you've had any problem like that and you're unhappy with a previous surgery that you've had, just call us at 424-465-3800. That's 424-465-3800, and we can help you and we can guide you and see if we can help you in any way or if not. I think it's definitely worth a try.
Yeah, definitely. And, in your experience, how do you feel that society pressures us? How do you think social media influences patients' desires for repeated surgeries?
Tell me about it.
I know how it is as a 38-year-old woman. I have people in my I was just thinking about this on the way here, to be honest. I get messages in my inbox with people telling me to go kill myself, that I'm ugly, to go,
You're kidding.
Yeah, just this morning. And I'm like, wow. I'm like, my goodness. I'm like, people are so hateful. So like, well, now then I stand in the mirror and I'm like, what do I need to change to stop getting people in my inbox telling me to go die, or that I'm nasty, ugly, and all the words I can't say on radio. But isn't that really? I'm like, and I'm not a bad-looking girl. If I say so myself, can you imagine what other people are going through?
Yeah, and like you mentioned, social media has contributed a lot to that. And one of the things that happened was once the front-facing camera was added to the iPhone, which was around 2011, 2012, teen suicides skyrocketed.
Wow.
Yeah, there's been studies on this, and a lot of people think it's because you're posting these selfies and people are commenting on it, and especially if you're a teen, you still haven't developed your personality, and you feel like your whole validation is based on how many likes you get and what other people say.
At 38, I still am. It's really, really tough. It's so tough, and being on a skinny level or thinness level. When I see certain girls on social media, I'm constantly comparing myself to them, going, wow, I'm not that skinny. She's skinnier. I want her thighs. I want her inner thigh gap. I want my body. I want my abs to look like that. I want my stomach to look like that. Even though I am thin and tiny, I'm constantly comparing myself to other women that are better than me. So I'm constantly feeling inferior.
Yes, but fortunately, you're not seeking plastic surgery every day, and that means you're not addicted to it, because you go home and you kind of check yourself and you realize, well, it's kind of unrealistic, and this is this is not real life. Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040, and leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105. A lot of filters on these social media apps are really killing people, because they see how they look like with a certain filter, and they come in and they want to look like that filter, and a lot of times you just can't. It's a filter.
I literally want to take my filtered face off of Instagram and take it to my plastic surgeon and say, I want to look like my filter. Because it becomes where, like, oh my gosh, I feel so low on myself because I don't look filtered anymore. I look like this. Yes, I truly do want to look like my filter. It's depressing when I don't.
And everyone wants, because and we've never had this kind of thing where, in the old days there was Photoshop and you had to really know how to use it to be able to change things. But now you just click a couple of things and you get a more snagged jaw, you get thinner, you get fuller face, and then all of a sudden you're like, well, I want these to happen to me. I want to look like that. So
now I have a question for you. Especially after, so a friend back home in Chicago mentioned to me something about how, because I've had 3 breast augmentations, and I must be addicted to plastic surgery. And she's just one of those girls, says her mind. Well, she speaks her mind. Are there any specific types of procedures that you find your clients are more likely to become addicted to?
Yeah, so one of them, as I mentioned, was rhinoplasty. Another one can be breast augmentation, although from what you've told us in previous cases, and although from what you've told us in previous programs, it doesn't seem like yours was an addiction type of thing. It was, you had legitimate things, and you had ruptured implant. But yes, one of the things that we all see is breast augmentation addiction. People just want to get larger and larger and larger, and we've seen it on TV. There are people who have 3,000 cc's in each breast. You know, that lady on TV that would basically crush a soda can with her breast.
Right. I think about the girl that came in and that she had such a huge BBL done overseas. I think she did it in Turkey.
Turkey.
And then she wanted you to go and take it all out. And there's no way they could have done the side BBL in one sitting. Like she would. Yeah. I mean, it was massive. And now she's seeing the ramifications. Remember, her back hurt her, everything hurt her. She couldn't sit right at this point. And I think about her, and now she regrets that.
Yes, absolutely. I think that's very legitimate, and I can see that.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800. Is there any roles that you play in the follow-up, monitoring a patient who might be prone to addiction? How do we handle that? Or how do you handle that?
So one of the things that I always remind patients on follow-ups is, well, where they started and when they came from. And also I remind them that we talked about the expectations and what to look at. Because the most important thing in plastic surgery is patient expectations. We need to set realistic expectations. Anytime someone promises you the world in a plastic surgery office, that's a red flag about that plastic surgeon, because they just want to take your money and just give you some result, and even if you're not happy, they'll just ghost you.
Yep, absolutely. I think back to the patient that she had work done and then never saw the surgeon again. He constantly just put her up on his nurse, on anyone else. And over here at Dr. Jacobson's office, we don't have anybody that sees the patient after. Dr. Jacobson sees his patients, before all the consultations in the OR, when they wake up, the following day for post-ops, all the following treatments. Like, we are very invested in seeing our patients from the start all the way until a year later.
Yes, and it's when you call us, it's very pleasant to talk to Ashley. She'll go through everything with you. What number should they call you at, Ashley?
424-465-3800. Once again, that's 424-465-3800.
That's right.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. How do you handle a patient who insists on undergoing a procedure despite your concerns about their mental health?
So that's a tough question, because there are different scenarios in that. So sometimes there are patients who have a therapist and who are working with a therapist, and I can tell them, well, talk to your therapist more about that. But a lot of times these patients are not really working with a therapist, and they're not really doing anything for their mental health. In those cases, I have to keep insisting that no, I cannot do anything, I cannot help you, I'm sorry, and just refuse, because at the end of the day, I don't want to do something to a patient that is not going to make them happy.
Right. And I just got a text message from a patient's husband, and she had multiple procedures with you. Spit it out, Ashley. But before I was here, and the husband texted me saying, listen, since my wife has had all these surgeries, she has changed. She's become a different person. She actually wants to divorce me. She won't go out of the house. She is not the same person anymore. What do I do? And I said, let me talk to my doctor, because I don't know what to tell you, sir. I'm so sorry. But he claims that her plastic surgeries changed his wife completely. And Now, you wouldn't have been able to know that because before her surgeries, she was one person. Did you see people change a lot after their surgeries?
So I haven't, but also we don't know what goes on in their relationship, and also we don't know what goes on with her mental health. And if you remember, we told them that she should see a mental health specialist and talk to them and also a marriage counselor.
Yep, absolutely.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040, and leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
So with that specific patient, I kind of thought maybe after her surgeries, she got a level of self-confidence from her plastic surgeries where she felt good about herself. She became more assertive, and her husband wasn't used to that and maybe possibly didn't like it. This could have been a good thing.
Exactly, and that could be very legitimate, and we only know that the husband's side where he says, she's not behaving the way I wanted. And that's why I think marriage counseling would have really helped them.
But this could have given her a level of self-confidence to finally step into her own, and feel good about herself, become more assertive, more self-confident. So it could be a positive thing too, not for her husband necessarily, but for her. So
yes,
yeah.
and it's very important. I'm all about woman empowerment, and having women have equal rights and being an equal partner in a relationship. So I think that's one of the things that will help patients, especially women, in their relationships, to gain their confidence and feel like, well, if I'm not happy in my relationship and I'm feeling better about myself, I should rethink my relationship.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. What do you think could be done in our industry to better address and prevent addiction to plastic surgery?
That's a good question. I think there needs to be more awareness amongst plastic surgeons that there are patients that can be addicted, but more than that is we need to remind plastic surgeons that we got into it to help people, not just to make a quick buck, make money.
Right.
Because a lot of times plastic surgeons might be prone to just ignoring the red flags and saying, well, I just want to make the money and I don't care what the patient is going through.
Yep.
And even if they're addicted, I don't care. And we don't want to benefit from their addiction. So I think bringing more awareness to plastic surgeons would be a good task.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. Well, our time together has gone by so quickly. This was a very interesting topic.
Well, I hope you guys enjoyed the show and got some good insights today. Well, be sure to tune in every Sunday at 7:30 a.m. on Go Country 105 FM to learn everything you need to know about plastic surgery. Whether you've already had a procedure or you're thinking about it in the future, we have many exciting topics we're going to be covering on the air. And as always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. And make sure you follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.